My name is Dr. Paul Knoll. I'm a board certified urologist here in Nashville, Tennessee. I'm making a series of videos to talk about certain medical conditions and then see if there's management options for those conditions. So let's get started. I wanted to talk about vasectomy. In order to understand the vasectomy, let's start off with the normal anatomy. As you can see at the bottom of the schematic here is that you have your testicle. The testicle is responsible for creating sperm. And the sperm travels through the tubing here that's looped around here called the vas deferens. The sperm travels through the vas deferens and then meets up in another tubing collection system, combines with the semen, and then is deposited into your urethra tube. And then when you ejaculate, the sperm and the semen come out the tip of the penis. Now, in order to understand the procedure, what we do is, it's in our office, and what I do is I do a numbing shot on each side of the scrotum above the vas deferens. Then I make a little incision into the skin, and then I grab the vas deferens and bring a little loop of the vas deferens outside of the skin, and then we cut it here, as you can see. By cutting it, it prevents the sperm from leaving the testicle and going on and joining up with the semen and then causing the conception down the road. So we numb you up, make the incision, deliver the vas deferens, and then we cut it, burn it, clip it, and then we also put it back in, and then we put a little suture on each side. The benefit of the vasectomy is that it's the most effective form of contraception. It's a very short, well-tolerated outpatient procedure. We'll talk about the risk of the vasectomy. There is initial discomfort during the procedure. When we do the numbing shot, that causes discomfort. That only lasts for a few moments and then disappears. Second thing is that there's some discomfort for a couple days afterward, anywhere from 2 days to 7 days. Most guys are about 3 to 4 days of having that discomfort. The other thing that can happen is there can be a delayed bleed into the scrotum afterward. That is something that is rare, but it does happen. And it's one of those things that even if it does and causes that swelling, there's usually no more intervention required. It's just a matter of you have some delayed healing. So you might have discomfort for more than 7 days, but overall, your body heals up very well from this. Some of the logistics, the first thing to keep in mind is that you are still considered fertile for the next 3 months after the procedure. There is some sperm that have made it to the other side of the cut tubule, and those can go on to mature and create fertilization, create babies down the road. So it just takes time for them to get flushed out. At that 3-month period, we'll get you set up with something called a fellow kit. And that's the most convenient way and accurate way to test that you are sterile at that 3 month. And our office will set up all that for you. It is a little extra fee there, but it's worth it because of the accuracy and the convenience of it. And then use your discomfort as a guide afterward. If something causes discomfort, don't do that. So you're trying to go do an exercise or go golfing and it causes discomfort, stop. But if you start to move around, you're like, that doesn't cause any discomfort, move forward with that activity. Your sexual activity will not be affected. You are not going to have any change in your semen volume, your sex drive, your erection, none of that has changed after the vasectomy. And then you can drive to and from the procedure. You do have the option of using laughing gas. I'd say it's about 50-50. Usually guys will use the laughing gas if they know they're a little nervous about needles or minor procedures. And questions regarding timing, insurance, payment, all those things will be discussed with our scheduler. So when they call you to get everything set up, they'll make sure that all those questions are answered for you. And the other big thing too is that we know things happen, family stuff, work stuff. If that does occur though, and you can't make your vasectomy appointment, please just let us know in advance. You are subject to a charge if you cancel the day of, because it messes up with the schedule and somebody else who needed that spot. So. But we're very reasonable. We just want to make sure that we get you scheduled in an appropriate manner. Overall though, the vasectomy is something that is a very, very beneficial, very low risk procedure. We do these all the time and we'll get you taken care of.